Okay, so today we're going to be doing a pickup impression. Our patient came in with a tooth that needed to be extracted, and we're adding a tooth to the partial. So a pickup impression is used when we need to fix a partial. So what happens is, and you'll see this, we will go ahead and put the partial into her mouth. Then we'll use heavy body and place the heavy body right over the partial. Why is it called a pickup impression? Because the partial will come up with the impression and stay in the impression, which we'll show you, and then that goes to the lab, it comes back, and the lab will be able to see where the gingiva is underneath the partial. And also we need to send in what, we don't need to send in what tooth color, because they're just going to match it to the adjacent teeth. Okay, so I'm going to place the partial in her mouth and just make sure that it's completely snug, okay? And then I will come in. I've already taken a look at this tray. I'm going to just make sure that it fits perfectly, and it does, okay? So then I'm going to load the tray kind of generously with just heavy body here. And I'm going to go all the way up to the flange here on the there. Okay. And then our same motions here. We're going to go in, pull the lip forward, go down, and then we will place it down, let it sit there, and then obviously on the lab slip, we're going to put add tooth to partial, designate the tooth, and then we've already alerted the patient that she will be without her partial for a couple of weeks while they add that to the partial. Sometimes I'll just use my thumb to press on the heavy body to kind of see how well it's set up. And you're going to see that it's still a little bit squishy there, so we'll go ahead and leave it for another 30 seconds. Okay, so we're getting pretty solid there. So we're going to try to remove it just softly here. Okay. And you see the partial didn't stay in there. So what we're going to do is we're going to just grab her partial, or I'll have you take it out there for me. Sometimes if the partial isn't solid in her mouth, it'll come out with there. If not, we're going to just press it in, and that's why it's called a pickup impression, because it should pick it up and keep it in there. So there's our pickup impression, and we're ready to go.